Good morning, Reverend Clergy, ladies and gentlemen. Welcome to another initiative of Center for Meditation Research, which is a series of talks on insights starting from this month. We will continue this series of academic discourse bi-monthly on a variety of topics on insights in relation to the mind. Today, we had the privilege of listening to Emeritus Professor Saroj Jayasinghe and Professor Vasantha Gunatunga on metacognition, followed by a discussion by the distinguished panelists, Senior Professor Vidya Jyoti Vajira Disanayaka, Dean Faculty of Medicine, Professor Dilshani Disanayaka, Director of Center for Meditation Research, Dr. Santosh Surya, Head of the Department of Medical Humanities. Now I respectfully invite Emeritus Professor Saroj Jayasinghe to deliver his talk on the topic overview of metacognition. Over to you, sir.
Good morning, and thank you very much for inviting me to make this short presentation on exploration of metacognition. Thank you. So today I'll be giving an outline on metacognition. I will briefly speak on the concepts and look at metacognition from different perspectives. And the perspectives I've looked at are from psychology, philosophy, neuroscience, and then hand over to Vasantha, who will expand on metacognition from a Buddhist perspective. So what's metacognition? I'll give you just a few seconds to think and reflect. It's basically thinking about thinking. And we do this quite often. In some occasions, we don't do it, we react without thinking. But metacognition basically means thinking about thinking. And if you were to look at the different perspectives, what I'm hoping to do is to look at it from neuroscience, philosophy, psychology, and try to tie these up with religion. In the case, here we'll be focusing on the Buddhist perspective. I'm not an expert in any of these, but I like to look at these interconnections and look at these from different perspectives and their relationships. So if we are to look at metacognition from these three main perspectives, in such a short time, we won't be able to cover much ground, but I will be specifically looking at, in the philosophical aspects, it's related to phenomenology, and in psychology, it will be metacognition in relation to educational psychology, and in neurosciences, from neurophenomenology. And these are the three main personalities involved. Husserl from philosophy, Flavel from education, and Francisco Valera from neurophenomenology. And we will first deal with philosophy and the phenomenology. Now, in phenomenology, what we do is to think about the thoughts which arise. And the focus is on things as they appear in our experience. And in phenomenology, we look at this from the first person point of view. Now, we are quite familiar in the Western medical profession to look at things objectively, but here we are looking at the subjective aspect. We are looking at our own experiences, which are activities of our consciousness, and we're trying to look at the different relationships between the contents of what we think. And you will immediately see that there is a relationship to some of the Buddhist practices we do. So let's take a simple example from a phenomenological approach. Now, there are various research approaches as well as philosophical discussions, but I'm just going to do a very simple outline. If you try to explain the feeling of breath from a phenomenological approach, you will be faced with this what we call natural attitude. That's, when you feel, if you try to feel about breathing, you feel that it is you, and you will be feeling a sensation outside that self, and we do that all the time. But in the case of phenomenology, the approach is to get rid of this natural attitude. And you try to do this by a process called phenomenological reduction. So you remove all preconceived ideas in relation to the breath or what it means to you, and you just focus on the sensation which you feel. And you're trying to get to the bottom of this sensation in a sense. And you will note that this whole process, which I've written here in further detail, is closely related to anapanasati, because in that practice also you're paying attention to the breath, and it's at the pure phenomenon that you try to focus on. You don't get entangled with the thoughts which are related to that sensation, and if other thoughts arise, you gently move your focus of attention again to the breath. Now, in relation to thinking about thinking or metacognition in psychology, as I mentioned, the focus is on educational psychology. And this is something which some of us have practiced. That is, we study how we learn, and we plan our studying based on this understanding of the psychology behind learning. And I'm happy to note that our faculty has included these topics in the medical curriculum. But let us now just give an overview of the educational psychological aspects of metacognition. So in educational psychology, they will describe this in further detail: an individual's awareness of cognitive processes, that's thinking and its processes, and the ability to efficiently assess and control these. So you control your learning, the processes of learning, even the content of learning, so that you optimize it. So to take a very simple example, even if you plan to revise, what are you going to revise? How are you going to revise? What's the psychology behind revision? How are you going to make your notes? And so on. And in educational psychology, this has been elaborated further. So you have metacognition in relation to knowledge and metacognition in relation to regulation. So your regulation or control of your thinking about thinking is basically to plan, monitor, and evaluate your learning. When it comes to metacognition related to knowledge, you have declarative knowledge, procedural knowledge, and conditional knowledge. And here are a few examples. Knowing that learning is enhanced by recalling from memory. So if you know that when you actively recall, you are likely to enhance your learning. So that's metacognition about your declarative knowledge. If you know that the best use of recalling information is after a certain period, and how you are going to do it, how will you proceed to recall? That's procedural knowledge. And if you know when and why you must do so to boost your performance, if you know that immediately trying to recall is not as effective as recalling it 1 hour later or 24 hours later, that's more of a conditional knowledge. So in other words, what I'm trying to show here is that metacognition in relation to education has several categories, and if you know these, it enhances your learning. Now again, you see the link to Vipassana meditation, because there you're monitoring the contents of experience, just like you're monitoring the contents of knowledge in case of education. And it's experience from moment to moment. You're not evaluating or judging. And there are similarities between metacognition in education, educational psychology, and Vipassana meditation. In relation to neuroscience, again, we see several trends. One is on neurophenomenology, where you look at the mental phenomena and try to link it with neurosciences like functional MRIs, EEGs, and so on. So that's, you're trying to look at the subjective aspects. And recently there have been a lot of work on meditation science, and the center is also proceeding in that direction of looking in depth at some of the effects of meditation on neurological function. So you have studies which have looked at neurological effects in relation to metacognition, and most of these studies are using functional MRIs. In neurophenomenology, you try to link the neurological changes with first-person narratives, what the person is thinking and what the person is the ideas the person have, and so on, making judgments and so on, and look at the neurological correlates. And in meditation science, you're looking at even deep states of meditation which alter consciousness and the effects on functional MRIs. So let's take a few examples. These are examples from functional MRIs on metacognition in relation to education, and showing that the areas, the networks which are affected can be different depending on whether it's metacognitive regulation or whether it's metacognitive knowledge. And also it depends on what we call offline or online, depending on whether it's more deliberative or intuitive processes. Now, the importance of this is that we are seeing different networks working or functioning and different areas of the brain being activated with metacognition. Now, when it comes to neurophenomenology, this is a groundbreaking book, The Embodied Mind. And here they've tried to link the human experience, again, first-person experience, with cognitive sciences. Now, you'll notice that in traditional medical sciences, we look down on subjectivity. We'll always go for objective signs, objective symptoms, and so on. But here in neurophenomenology, they have in fact taken the bold step of carefully looking at the subjective phenomena. And this whole field has virtually exploded in the past few decades. What's fascinating is the recent studies which have been done in places like Harvard and MIT, where they have looked at deep meditation. And some of the states which Vasanta will speak about have really been found to have certain neurophysiological correlates. And these are using the state-of-the-art MRIs, the 7 Tesla MRI, used for the first time. This publication came fairly recently. And at the stages of jhana, what they call advanced concentrative absorption meditation, some of the subjective feelings expressed by meditators seem to be related to particular neurophysiological signals coming from EEGs and MRI, functional MRI, going right from the cortex even to the brainstem. So something is happening. It's not just imagination. And these are not pseudosciences as people used to tell us some time ago when we were exploring these ideas in our own faculty. And the meditators described this. In fact, Vasanta is the best person to mention here, to describe, to say that it is not describable. Right? So it's this, of course, they've tried to describe it by saying heightened attention, clarity, effortlessness, and bliss at particular stages of meditation. And that's related with certain changes in the functional MRIs. So in my brief lecture, what I've tried to do is to take 3 main threads, phenomenology from philosophy, educational psychology, and neurosciences from the hard sciences, and show you that there are links with Buddhism in all this, and some of the Buddhist practices. Of course, this is seen even with other forms of religions, especially Hinduism and other meditative practices which are there even in Christianity. In a sense, though we focus on philosophy, psychology, and neurosciences, there is a large volume of information untapped in our own traditions of mindfulness, of meditation, and innovations like what Vasanta is going to speak on perfect mental health. So you will now understand this first picture which I was trying to show you, because not only are these related, Buddhism, in a sense, has a lot to contribute because it's at the base, and there is a lot of, it forms a root actually to some of these scientific findings which we are now becoming aware of. Thank you very much.
Thank you very much, sir, for that insightful talk on how our minds think of thinking. And now I would like to invite Dr. Vasanta Gunatunga to present his talk on how to stop this thinking process. And he has the topic mentioned as understanding who we are, body, mind, and memory.
Thank you very much. Good morning, ladies and gentlemen. Let's talk about a little bit of experience that we had regarding metacognition and insight. If you ask yourself whether you had a worry in the recent past, or if you ask somebody else, a friend of yours, whether they had a worry in the recent past, everybody will say yes. Big or small, they had the worry. So we have an issue of this worry, stress, pain in mind, together with the physical body changes. And then we need peace of mind and mental well-being. All of us are looking for this. And better performance in the workplace, productivity, and all that. And some of us need to understand what we are made of. We are thinking, we have a physical body, we have a memory, and how all these work together. And here in this, the audience online, everybody are a different kind of people who are interested in this insight, seeing into our own self or going deep into somebody else's life so that to see whether we can help to solve some of these problems. So we are a very special lot. I'm happy about that. Why am I interested in this is that I'm a teacher. Way back in 1990s, when I was a young lecturer, I was teaching health to my students, and WHO defines health as complete physical, mental, and social well-being. I was teaching, those days I was a handsome guy, not like now, like the audience at that time. And one student asked, sir, what is complete mental well-being? I got stuck. I thought I knew everything, but I didn't know. So I said, I don't know. And then I said, I would find it for you. So from that point on, my main research was finding that what complete mental well-being is. And I did that for almost 15 years before I actually found it. So I am interested to find out what is happening inside, so that my profession, primary profession is a doctor, to help a patient. Patient, whatever the physical illness they come for, they also have a mind. They have a pain in mind, fear, apprehension, uncertainty. And a doctor or whoever, the health personnel, not necessarily be doctors, not necessarily be a health person, somebody else, anybody, to help somebody else, we need to know that this mind component as well to help a person. So this is very, very relevant to all of us. So to find this, the methods that I use, if I share with you a little bit, conventional methods, reading, searching, and then talking to people, taking part in conferences like, there was a conference about consciousness, and many conferences like that. The conventional methods I used. And then talking to psychologists, I often have a chat with Santoshi, who is our psychologist in our faculty, and then other studies. And then I went into religions. I studied almost every religion to see how these religions help people. They really do a very good job, all of these religions, to help people. And then Buddhism, the techniques in Buddhism, meditation. I took up meditation and did that meditation 2 hours every day without fail for 15 years. And I'm continuing that. And I'm going to share my experience with you, the experience that I gathered through this experiments. Through that, I was able to analyze this cognitive process and to go beyond thinking, to explore the metaphysics, the epistemology there beyond mind. So that is very fascinating and very interesting and very useful. What I found is that basic thing is that myself is made of 3 things. Physical body, that is visible, everybody knows that. The mind, and a memory. This is dissecting myself into 3. You can dissect this into more, into 4, into 5, into 6, into 12, 18, 36, like that. So the basic analysis is body, mind, and memory. I am I like this body, mind, and memory because it is easy to take the analogy of a computer to describe this to a person who has not meditated and not gone into the metacognitive sphere. Computer has input devices, mouse, keyboard, scanner, like that. It has a processor and it has a hard disk or storage or cloud or whatever, a place to store. We also have the same thing. We have the senses, eye, ear, nose, tongue, and the physical body. We have the mind to process, and then we have the memory to store. When we want, we can retrieve from the storage, like in a computer. So there are dissimilarities that never can be matched. So we'll see what these are later. Now, looking at how the mind works, there are in the physical body 5 senses, like the senses in a car: eye, ear, nose, tongue, and the skin or entire body. The black arrows are when they capture the external environment. I can see things around using my eye. As much as I'm seeing that, I can get a pain in my eye, which is the red thing coming from the physical body. So all these come to the mind one at a time. There's a gate there. It allows only one. The mind decides whether to take this information, whether it is relevant to me. There are a lot of things falling onto our eye, we disregard, and we select things. This selection is unique to each individual, and then accepted. Once it is accepted, it goes to the memory. You have no control over that. You give a value, it goes to the memory. Once it goes to the memory, it's bound to pop back into your mind as a thought later, sooner or later. So this is the problem. This has no control. Computer has a control because it has been programmed when to retrieve that information, when to disregard it. But we have a unique thing in our mind, which is a control center that determines which one is picked from the memory, which one is disregarded, and this control center is actually beyond our control. So it does what it wants. So this is the problem that we have. That is why this stress is generated from information that is actually that we don't need, but the mind captures those and make us stressed. Not only the mind, the physical body as well. So this middle thing, mind, does all the things like accepting, processing, decision making, and then synthesizing new things. All that is happening here. So this is the normal thinking process. This is actually trapped. We are trapped in this. Unique traps. This trap is unique to each one of us. But the way it acts is the same. So within this trap, we cannot look at it, ourselves. So being in that, we can't look at it. We have to come out of it. So this arrow that is dotted, the broken arrow, yellow arrow coming from down upwards, there's a technique of interrupting this process. If you interrupt it here, you stop information coming from outside, from the physical body and the memory. If you stop that, this thing stops. And that is where you start a new thing, new way of seeing it. How you do that is 100% practical. You can't read about this and get the first-hand experience. You can't talk to a person and get first-hand experience. So with the little time that I got, 20 minutes or so, I spent 3 to 4 minutes to give a little training to you for that my work is complete here. This is how you do it. In very brief terms, you keep your body still. The body absolutely still. So best way is to sit on the ground in this position, but we now don't have facility to do that. But while sitting here, keep the upper body straight, neck straight, and the left hand on your lap. Now it is difficult for you to put the hand on the lap. Wherever it is, put it like this. Right hand on the left palm. And then we use the mind as a probe to scan the body. To scan the body, we identify 6 body parts: head, right arm, chest, left arm, right leg, left leg. That's all. We use compassion as a tool of removing attachment. To use compassion, we say, may all be well, happy and peaceful. Nothing, no mention about myself. May all be well, happy and peaceful. That's all. So you take the mind around this like this, in circles, so that mind is occupied. So give this task to the mind. I said there's a gate, there's only one thought at a time. If your mind is occupied like this, these 3 sources cannot send in any information to your mind. So mind is engaged. So we'll do that. We'll see how it goes. So I will take you through one round, and then I will stop for 2 minutes, and I will call you back in 2 minutes, and then that is the training, brief training. Ready? Okay, great. Now close your eyes. Bring your mind to the top of the head. Taking the mind in a circle, you contemplate or say to yourself inside your mind, you are close to your lips. This is all within the mind. May all be well, happy and peaceful. You go to the upper part of the right arm. May all be well, happy and peaceful. Front of the chest. May all be well, happy and peaceful. Left arm. May all be well, happy and peaceful. You go to the upper part of the right leg. May all be well, happy and peaceful. Left leg like that. May all be well, happy and peaceful. Come back to the top of the head. May all be well, happy and peaceful. Right arm. May all be well, happy and peaceful. Front of the chest. May all be well, happy and peaceful. Left arm. May all be well, happy and peaceful. Right leg. May all be well, happy and peaceful. Left leg. May all be well, happy and peaceful. Come back to the top of the head. May all be well, happy and peaceful. Continue like this for 2 minutes. Then I will call you. Okay, thank you. Very good. Remember, you are in first supramundane absorption. I have no time to describe why I say that, but that is a fact. So this practice, make it part of your lifestyle. Do it for 5 minutes in the morning, 5 minutes in the evening, and try to improve on time, increasing 5 minutes every week. You can communicate with the Center for Meditation Research for further advice if you need any further advice on this. So when you do this, when you get used to it, it reduces the clutter of thought, which is sometimes a harassment. You cannot stop it. Now we can control it, reduce. The mind learns to let go of the unnecessary stuff, making the mind clearer and clearer. And you learn to slow it down and at one point to stop it. And then you are able to analyze a single thought that is coming in and going to the memory in a backdrop where there are no other thoughts, which is very fascinating. And you can look at the trajectory of this thought going round and round. If you want, you can look at further. If you want to stop at one round, you can do so and then go into your serenity again. When you want, you can come back to the analysis part and look at more things. So that is how you actually operate going into insight. So this little more detail about how the mind process works. I'm not going to describe this in detail, but later we can, if you're interested, you contact us. We'll have a discussion on this. So this briefly, this is where contact occurs. Say this is the eye. Then you add the value here, and then you store. You do a little matching like face matching systems in biometrics to identify people. You identify, then you recapture the identified image as this is the one that I saw. I have seen this before. And then you recontact and give it a value. Then you start liking or disliking, and then you have clung onto it, and then you start ruminating on that. So this is how it happens. At different points you can stop this. We'll talk about that later. The advantage of going into metacognition and getting insight and getting this training is extra special metacognitive skills that the people who run only with a normal thinking process cannot acquire. And less stress, you feel better than earlier. You don't handle unnecessary stuff, and you stay away from those. And you make less mistakes, and productivity becomes higher. You are a better person, you become a better person, happy and more contented. And there's a good work-life balance. You are a better husband or better wife or better son or daughter at home. More buoyant, smiling, light, and nice to see. And you see purpose of life, and you can manage your anger, and you develop a happiness halo. And this is very important for HR people or to anybody. You become a person who is pleasant, smiling, light, talking to people, engaging. Maybe 1 minute or few seconds is enough to engage with a person 100%. Give 100% to that person for that 5 seconds. Say something, I am too busy right now. I'll speak to you in half an hour. I'll be free. Can you wait for half an hour? That is fine, because you have given 100% to that person. And then you create a group of people around you who are happy, who will love you. This compassion, this happiness that you give returns. So you are in the epicenter of a halo of people who are happy and contented. The final achievement, you become able to quickly shut down, 100% shut down, like a computer. You can shut down your laptop, but you never shut down yourself. Even if you sleep, you dream. You call the dreams for the things that you remember. A lot of things you don't remember. Mind doesn't sleep. And so from time to time, mind wakes you up, the physical body. Professor Dilshani will tell you the sleep comes in cycles, not a flat like this nice sleep. So this rest and being able to shut down and reboot like this and come into action is a nice thing to achieve. And the relaxation, quietude, inner peace, and insight. The last slide. Insight, if you look at search, seeing the fundamental constituents of one's own self and how this interact, that is what we talked about just now. Seeing why we do what we do and redirect ourselves. We don't see sometimes why we do what we do. And we start seeing that, and we are able to navigate better in turbulent waters sometimes and to go to our target. Being able to shut down and reboot and knowing the technique of doing it, and being able to analyze other phenomena to the core. Become a much analytical scientist of different nature. Become a scientist of different nature. This is also science when you go into this. Thank you.
Thank you very much, sir, for that theoretical and practical knowledge on the metacognition. So now to further elaborations, clarifications, I would like to invite the three distinguished panel members to the head table. Senior Professor Vidyajyoti Vajira Disanayake, Dean of the Faculty of Medicine. Dr. Dilshani Disanayake,
Director of the Center for Meditation Research, and Dr. Santoshi Amarasurya, Head of the Department of Medical Humans. Yes, a stage is open for you to ask questions for the on-site as well as online audience, the participants. If you have any questions, you can unmute your mic and ask questions. So either you can post your questions in the chat box, or we will present them to the panelists as well as the two speakers, Professor Saroj and Professor Vasant. And till you get ready with the questions, I was asking from Dr. Santoshi about, because Professor Saroj talked about education and psychology. So I would like to ask you, how do you relate metacognition to meditation in the perspective of education and psychology?
All right, you can print.
Okay, so from the regulation component, there are various aspects like planning, monitoring, evaluating. So a lot of thought processes are getting sort of activated. And we always talk about this concept of timelines. So really metacognition can be thought of as think management. So that is what metacognition is. And then Professor Gunatunga was talking about how meditation actually helps you to dial things down in your life, to slow down processes. So really then you might have this question that, you know, metacognition is this process where you really activate your thought processes, and then meditation is talking about slowing things down. So what is the connection there? But really meditation does provide a foundation, because it is helping you reduce that chatter. So let me just elaborate that through an example. Let's say there is a disagreement between several people. I have a huge argument. Let's say you're in the center of that argument. So there is a heated debate, many people are getting very aggressive. Then you get involved in that entire process, and you know, you're trying to sort that situation out. But if you were to remove yourself from that situation and you take an aerial perspective of what's going on, perhaps you have a better understanding as to what's going on. You might see how people are expressing themselves, what is working, what is not in that interaction. And you might also see things that are happening in the periphery. If you were right in the center within that argument, you might not see someone at your extreme left or right, that person getting worked up and suddenly jumping in and getting into that argument. But once you have an aerial perspective, you can see things happening. So that is exactly what meditation also does in terms of helping in that metacognitive process, because it's making you step back and look at what's going on. So you take away that attachment that you have of the situation. You remove your cognitive biases. Now, as soon as we get involved and we get fully engrossed in a situation, you are unable to think about what's right, what's wrong, what's working for me, what's not good about what I do, because, you know, all these different attachments come into play. But as soon as you remove yourself out of that situation, you're able to see things for what they are. So you get a sense of objectivity, and with that objectivity, then you're capable of really looking at, for example, you're talking about the educational process. What's working for me? What's not working for me? What do I need to change? How can I change it? So that sense of objectivity comes into play when you sort of remove yourself, and that is what meditation is helping you to do. And similarly, Professor Gunatunga took us through an exercise of taking our mind across different body parts. Now you're also improving your attention, and you do need a lot of attention to be able to focus on your thought processes. Hence, you become a very good think manager by this meditation process, and that helps your metacognitive abilities. So from a psychological perspective, strategies that we sometimes use, maybe when you're not using meditation, some other strategies that you use is you help the person to distance themselves, or you sometimes say, take a third person perspective, because you're trying to help the person remove themselves out of that situation. That is what you end up doing in a meditative process by sort of removing yourselves and then helping you to see your thoughts for what they are, and then sitting back and really analyzing what's going on.
Thank you for that explanation. So if you have questions, yes.
Just a more of a comment as well as questions for the panel. The first comment is actually when just before I spoke to my phone drops, and focus myself to the patient and distract. So I use meditation. Try to Anapanasati, but then if I have noises behind the background, then I probably switch to Maitri meditation because not concentrate to focus it. I would like your opinion, or any of you, if I still get noise or any other distraction while I'm doing the Anapanasati, how I can continue with Anapanasati, if that's all. Other question is actually, I feel that if I don't get distracted or disturbed for about 30 minutes, amount of relief, as Dr. said, the shutting down is, if I can do it for 30 minutes, it's more likely I will get this shutdown feeling, focus, and feeling I cannot explain sometimes. Probably Dr. can explain to me. Compared to if it's just 5 minutes, it's not that relief, the shutdown feeling I will get. So I would like your opinion. If I get disturbed, how can I still continue to do it? Is there a possibility, or?
For the benefit of those who are online, I think the question is, when you are doing Anapanasati or Metta meditation, if you are getting distracted, how do you overcome that? So the question is for Prof. Gunathunga. Prof. Gunathunga, if you come here, I think it's best if you just come here and talk to this mic. Yeah.
Thank you for the question. That's a very common question, actually. There are more than one question there. For every meditator, when you meditate, these distractions are very frequent. When you get these distractions, as I told earlier, the mind, there's a gate, there's only one thought. If you have this Anapanasati, you stick to it, then that outside thought cannot come in. Even if it comes, it doesn't get registered, and you don't start a rumination on that. Dies halfway. So more and more practice will reduce this problem. So you need to practice a standard practice time, while not doing the ward round or not seeing a patient or not driving, but sitting and doing it. And this time is only for meditation. So that is the training time. While you work, that is the time of application. So if you have a solid training time, regular training time, then application will be easier and you will feel the progress. So that is the answer to the first part. The second part was something about the method. Meditation, what you do will depend on what you want out of it. You have to have a final target. This is my vision. I have to reach there. So if your purpose is to, reduce factor so that you can work better and be at peace, then you select 1 or 2 or 3 methods and do it. Anapanasati, Maitri, or whatever will help. If you want to go beyond, then you need to rethink about your method and find the method which is correct and tested and proven. So we can discuss about that further if that is the interest. Did I answer your question? Oh, okay.
Professor Saroj also likes
I'm no expert here on meditation as such, but it's interesting what you're trying to bring out, because because with practice, it has a neurophysiological basis, because that's the difference between the trait forms. And with so many thousands of hours of meditation, you know that there's neuroplasticity and then the brain changes structure. So that's why with more and more practice, you're able to get to those states. And if you really look at the expert meditators, long-term meditators, and novices and controls, you find that the way they respond to external stressors differ. From functional MRIs, you find that they are responding differently. That's because the long-term meditators, or those who have developed the trait, have gone in, their pathways are different. They have developed new networks. So this is very interesting, because if you ask, when you speak to monks who have been meditating for a long period, they seem to handle life differently. That's because they are rewired. They are basically rewired. And this new meditation on deep meditation and the research which is coming out, again suggests that you can rewire badly wired brains. So there's potential even in certain extreme psychiatric disorders and even in personality disorders. So you can rewire the brain without drugs.
I think I will give the chance to Professor Devshani also. I think it's the best time to talk about neuroscience of cognition in relation to the question.
Okay, thank you, Jivani, and thank you for the question answer. So now, if you're starting with the term cognition, you would have now heard different aspects and views of metacognition as well. So cognition in neurophysiological view is we relate them to executive functions, so higher functions like thinking, problem solving, judging. So those things are more related to the prefrontal area of the brain. So you have seen in Professor Saroj's presentation also the areas that were highlighted in research related to metacognitive skills are also related to prefrontal area. Metacognition is being able to control or modulate or overview the cognitive skills. Those are also related to executive functioning. Those skills also we all have. So we have problem solving, judging, knowing what is right, what is wrong, and then we are trained to look at our thinking. We have the ability to look at what we think, and we have the ability to solve problems, and we have the ability to know what is right and what is wrong. And also with time, we have the ability to sort out cognitive conflicts as well. So there are information coming, even if you don't get information from external sources, you get information coming with emotions, memory, and there are clashes inside, which we call as cognitive conflicts. Even if you're closing your eyes, still something will come and there will be conflicts. And your metacognition will help you to sort them out, will help you to see. So with training, whether it's meditation or whether it's studying or whether when you go along in your life, sometimes you get pro-training towards development of metacognitive skills. So one of the methods that we discussed today was meditation. So now with neurophysiological, neuroscientific research, neuroplasticity is the main explanation for the changes. And people have seen changes, even the size, volume, and activity in the prefrontal cortices of people who have been meditating for a long time. So they have higher metacognitive skills, higher functioning in the prefrontal cortex compared to the emotional area, which are also driving us to take actions. So there is a lot of good connection between the connections, networks between the emotional and the prefrontal cortex are also strengthened during meditational process, so that even our emotionally charged actions can be better modulated. So those are some of the effects of meditation, neuroscientific effects of meditation. So there are a lot of networks that can be targeted. So even in our research study, we found the increase or enhanced cognitive skills, changes in the EEG, changes in the neurotransmitters, which are very positive towards better mental health, better metacognitive skills in meditation. And I think to answer neuroscientifically to your question, Because we are trained to think that meditation is concentrating on something. And if your mind goes around and if you go and listen to another sound or something happening around you, that is not how it should be. We as, especially people who have been educated, we are very good at concentrating. Now, let's say we are doing a surgery or if we are answering an exam, we are not usually, unless the exam is very difficult and you don't want to really focus on it, if you're really concentrating on it, we have this ability to concentrate very well. Then what is happening around you is not a big issue. We'll not be giving our attention to what is happening around, which is, we will be aware, that is called peripheral awareness, but we can maintain our stable concentration. So initial stages of meditation will help us to achieve that, to have very strong, stable concentration, but you will have heightened peripheral awareness, not just you're shutting off your periphery and concentrating on something. But it's easier to develop stable concentration at the beginning so that it will be very helpful for these brain pathways to be active. So you knowing that your mind is going to somewhere else is very good, because that is like you are aware of your mind wandering. So there have been MRI studies which have been done on people who are meditating with mind wandering. And they have found areas which are stimulated. The realization that the mind has wandered is also an achievement. And then you bring it back. So like that exercise, that cycle is quite all right. So if you have that, rather than worrying and making it a stress, what you have to do is to enjoy the process that you're going through. So you concentrate and the mind is wandering. You know that the mind is wandering and you bring it back and you do that exercise, but in a relaxed way, enjoying what you're doing. So if you make it a stressful, a target-oriented process, it's going to be another stress added to our life. So if now usually we meditate, one of the main objective of meditating is to bring down the stress or the deviation from usual homeostasis. So from our research also we've seen there are a lot of factors that, like the stress causing factors, are suppressed or brought down by long-term meditation. So there are good effects. So we should not stress ourselves about the method of meditation. So if we try to concentrate and increase our peripheral awareness at the beginning, slowly we can go towards and see that we can also move away from this concept of I. That is like, it's a stepwise thing, or it can be a stepwise thing, or it can happen quickly. But the main thing is not to have a big target or reward-oriented behavior related to meditation as well. Because our life is, we are looking for a purpose, we have targets, we go for rewards, and if you take training or calming your mind also as a reward-oriented, target-oriented behavior, that is going to slow you down a bit. So I think it is good that you know that things are around you, distracting you, but then you bring it back to your subject of concentration is an achievement.
There's a hand up on the screen. Can Lalit very good?
Yes. First, thank you very much for giving this opportunity for me. I'm Lalit from Sampath Bank. I need to clarify one point. Assume that when I'm driving only focus for the driving. When I'm cooking only focus for the cooking. Is that the part of the metacognition? Without focusing my mind into other area, I do something fully focusing for that respective task only. Is it part of the metacognition?
Doing one task at a time, is that what is meant by metacognition?
Metacognition has different.
You better not use it.
Different meanings, but in driving.
Professor, talk without using it because you are echoing.
While driving, can you hear me?
Yes. Yeah.
While driving, what is required is what happens mostly is while concentrating on the road, we are concentrating few things. The road, few other vehicles, your instruments, things. What are not necessary is billboards, the people going far away and some other interest away from the road. But they are designed to catch our eyes, catching the driver's eye. So we should be able to let go of these things and then concentrate only on the road and the required things. And that needs certain amount of discipline. Some people are born with that skill, others can train. So when you train, you can go into metacognition part. Metacognition, if you define it as beyond thinking or looking at thinking, your own thinking, then you can also think that, am I concentrating or am I not? Is my concentration enough? Then you can readjust. So that is, you can call it part of it as metacognition.
Yeah, it's really about emotional intelligence. Is it genetically modified or is it behavioral? Because this question came when we are looking at our children actually. Because we see in our students also like a big generational gap, how they empathize with patients, and there's a huge gap from our days to now, and we can sometimes wonder whether our children are going to be very emotionally distant. And I will always ask this question.
You're kind of, Chamila, opening up a can of worms. So, I mean, it has been interesting listening to all this discussion, and I can tell you my own experience of meditation and everything. I'll come to your question. Has been a purely self-exploration. And, since we are having a series of, these sessions, maybe on a future session, I will take you through my own experience and give a different perspective of what I feel that that we can discuss. So I think when it comes to meditation and going, all that we are discussing, these are personal journeys that all of us have gone through, and we can give certain guidance and guidelines or, certain clues, but you have to have your own personal exploration, and that has to happen. So coming back to your own question, of, is emotional intelligence genetically determined or not? My answer is I don't know the answer to that. But we we know that sometimes you have parents who have got first classes in their entire life. First in class, go to medical school, get first classes in the postgraduates, and so on. And then they have a child who has a known genetic condition. And the child, no matter how brainy or whatever the parents were, will be intellectually disabled. So there is a certain genetic component where, if I were to use the colloquial terms without going to the genetic terms and say, basically the correct or the important genes are mutated, then you can't achieve what we are talking about here today, right? So there is a certain genetic determinism when it comes to that. So I don't think we can talk about meditation and achieving all of these things with a child who has one of those severe genetic mutations which put you down there. But at the same time, I guess there is a certain, the average person who is out there can be, through meditation, taught to have better awareness. That's what we are trying to do here. All of us who have been practicing meditation have had experiences which we would not otherwise have if we had not taken up to meditation, right? So therefore, I think there is a certain level of training that you can bring about better emotional intelligence through meditative practices. So therefore, the average, if we say there are those children who do not have a genetic illness or something like that, who have what we may call even a little deviation from the norm, I guess meditation probably has a place to bring them to better understanding and better level of control. So those are the kind of, I think, research that we need to do in the Center for Meditation Research, because we should be exploring not only the attainment of higher levels for the normal people, but also how can we use meditation as an intervention in certain situations to bring about changes. I can tell you my last consultation a few days ago with a parent who had a child who we diagnosed a genetic condition. We know that this child will not only have intellectual disability, but as you go on, develop various other mental illnesses, mental health issues, right? So then how can we know conventional treatment cannot, help them. But now here is a group that we can actually work with in the center, because we have the genetics unit downstairs center somewhere here in a virtual space, but we know it exists. And we can now get a group of such children, do some of the interventions that we know we can do, and see whether we can prevent them in later on in life developing these mental health issues. Because it would be a fantastic relief for the parents, for the families, for the health system, and so on, if we can do so. That is, I think, what we would like to do. I mean, in that context, I think question that Giovanni had for me was how can you integrate, what we are doing here into the medical curriculum, right? So I go back to Professor Saroja's and of the World Health Organization definition of health. It's a complete state of physical, mental, spiritual, well-being. But for us in our medical curricula, the mental, we are only dealing with, in the maybe the psychiatry component of our, curriculum. Yeah, we are trying to teach with, we are dealing with those who are ill and how to treat them, but we are not dealing with these things that we are talking about here today. So we need to find certain entry points into the curriculum, and one simple, very simple entry point would be, what if we can all, before we start a lecture, get the class to engage in mindfulness meditation? It can be done. I was told the other day by someone, it was Vinya Ariratna. Vinya was told to come to Moratua to do some class to IT students. So he went, but he was late. So he thought he will walk into a very distressed, environment. But he found the entire class seated and meditating. So the lecturer was late. Nobody was distressed about the lecturer being late. The class was seated and meditating. So why can't we do that? That's a simple entry point. Of course, I also want to, hop on the point that Vasanta made earlier. We all meditate for different reasons. That reason we will know. And when I have a time to talk, I'll tell you about the reason why I started meditating. But the simple relaxation, mindfulness is something which is relevant and necessary for all of us. And that is not a religious thing. That is not a thing that you need to, go into the scriptures or anything like that. And that is I think for me, the entry point of meditation to our students is getting them to sit down and meditate. Do mindfulness meditation for 5 minutes before a lecture. So first we have to teach our lecturers how to do that. So I was telling Vasanta, he needs to, in our faculty board, get us to meditate for 5 minutes. So it probably that would be the entry point for us.
Thank you. There's a question by the lady at the back. Yes.
One of the associated meditation, metacognition is strongly with meditation. What are the other ways of achieving metacognition? That's one question. Other question is, Chamila has asked some of it, but my question is, it made it sound like this metacognition is something that achieved through a lot of striving, meditation, practice. Isn't there, are some people genetically predisposed to achieving metacognition, or is it something that people strive from zero and achieve? I think some people have a biological or a genetic advantage.
I think for the people on the on Zoom, you would have heard the question. The question was: is meditation the only way to metacognition? What was?
Okay, I think Santusha, that's a very important point. We actually slanted towards meditation and metacognition because this is a session organized by the Center for Meditation Research. But yes, metacognitive skills we develop throughout our life. We are looking at how we think, how we work, and even during medical education, you have realized we bring in a lot of metacognitive skills in our students as well as our teachers. So those are like fundamental executive functions where we observe our thinking, problem-solving patterns. So that is one way of developing our metacognitive skills. So another way to observe and to develop some of our metacognitive skills, especially observing how we think and how our thought processes are progressing, meditation is an important aspect. So we slanted towards meditation because the session is on meditation, and also because there's a lot of neuroplasticity with meditation through our research as well as other researchers have shown. So one way to achieve these metacognitive skills and beyond executive functional level is this. Yes, and I think Chamila's one was emotional intelligence. Santoshi, do you want to answer that?
Yeah. Also, just from your question, so there are so many other ways that you can develop metacognition from things like reflection, introspection, and I think I mentioned certain strategies that we use from a psychological point of view. You ask the person, it's almost the same thing maybe that you're doing in meditation. You say, take a distance perspective or take a third person perspective. The objective of that is to make the person more aware of what's going on. Your thinking gets sort of messed up when you jump into the situation with all your biases and you're incapable of separating yourself from it. So really, the meditative practices, they provide a basis for metacognition. But there are so many things that have to go on: critical thinking, problem solving, planning. So several strategies would have to go into play. From the point of view of what genetic component there is, there might be certain genetic components. From a point of view of emotional regulation or personality, there would be certain determinants. But the very good news is a lot of these things you can learn as well. So coming back to Chamila's question, or the root of it, concern as to, can you train your kids to be more emotionally intelligent? Yes, of course you can, because these are skills that you can train people to have. So yes, there might be certain problems of emotional regulation. There might be deviations where, as Professor Isanaik was talking about, where you're talking about more of a disorder level, but there are things that you can definitely do to make people look at things in a better way.
To add a little to what you asked, it's get genetics from the parents. Mind is rather independent. It's not random also, it's not ad hoc also. There's a pattern which we cannot easily detect, which mind comes to the baby of which parents. But the mind factor take two identical twins. Genetics is identical. They are not identical in their behavior. So mind makes this difference during the intrauterine life, also during organ formation. Later on, when they are out walking about and associating with the community as well. So the presentation of genetics can be different depending on the nature of the mind.
If I bring a little bit more neuroscience into it, when it comes to emotional regulation, we have, if we say mind and brain are the same and the functions are mainly determined by the brain function, we have emotional areas in the brain which are activated when we are emotionally charged. Let's say there are areas like amygdala, ventral tegmental area. There are different areas, especially amygdala is stimulated when we are anxious, when there's anger, when there are drives. Now, what researchers have seen through meditation is that the size and the function of the amygdala decreases. Now, that has been actually confirmed. And also the connections between prefrontal cortex and the emotional areas are strengthening. So there is neuroplasticity. So emotional regulation can be enhanced by meditation as well, irrespective of whether you are genetically more prone to be emotionally charged. Still, those regulations can occur due to neuroplasticity. So people can be trained. I think for emotional intelligence, anyway, training does a lot of changes, whether it's meditation or psychological training.
I have a question. Now, in relation to the medical curriculum, now there is a lot of data to show that metacognition gives advantages to students in the process of learning. So, if you look at it from that construct of metacognition, how can we use that in our educational strategy with our students? What's the curriculum to bring in metacognition and this reflection to our students? I mean, we can talk of mindfulness and teaching them emotional intelligence and so on, but would a curriculum in metacognition look like?
I don't think we need a curriculum in metacognition. That's what I feel, because it's the definition of metacognition is, putting it the simple way, like know how the brain works, right? So that is something that you will need to, if it's related to you, then that is something that you will need to find out for yourself, right? By being aware of what you're doing and being I would say reflecting on what you're doing. So if you want a curriculum, would be a curriculum which is devoid of meditation, would be a curriculum that teaches people more to reflect and to have more and more reflective practice, and that we are doing in different ways, like portfolios and different things, and that is the kind of the lowest level of becoming self-aware through reflective practice. But what I feel is today, if you want to change our curriculum, I think knowledge is at our fingertips. So I don't think we should be lecturing. We should be creating a more hands-on experience, curriculum where we don't lecture. They can listen to lectures which are online that we have recorded and put their convenience. but where people are more and more, students are more and more from the very beginning engaged in group work activities, hands-on with patients and so on, and maybe a shorter curriculum. A 4-year medical curriculum. That's what I'm thinking. I mean, I think that's where some of the world is going also currently. And that's a radical statement for the dean of the faculty to make. But I think we need to really make such statements to because unless we do that, we will not use the current technology that's at our hand. And
Okay, with that radical thought and opinion, I will end the session today because we have run past the time. So I will propose a quick vote of thanks. I thank on behalf of the Center for Meditation Research, Emeritus Professor Sarojaya Singh and Professor Vasanta Gunatinga. Actually, both of you came up with this idea of metacognition. So thank you very much for starting a series of talk like this. And I would like to thank the 3 panelists, Senior Professor Vidya Jyoti Vajitha Anayaka, Professor Dishan Disanayaka, and Dr. Sandesh Surya. And also I want to thank Professor Indika, Karnatilaka, and Dr. Ashwini Diabdu of the Department of Medical Education for providing this venue. And also Sanduni, Daktinu, and Devaka from the Dean's Office for supporting in logistics. So thank you very much, everybody. So most gratitude goes for the participants, online, both online and on-site. Without you, we will not be able to have sessions like this. So thank you very much. So we will meet up once again, maybe perhaps in another 2 months' time. So please feel free to drop your suggestions, ideas in our CMR email, cmr@cab.ac.lk. So thank you very much once again. Have a pleasant day.